So this is the IVU. As opposed to the lower GI, upper GI, and esophagram, these are not post-fluoroscopy images. They're images taken during the course of the exam, timed images. There is no fluoroscopy involved in the IVU. It's just injection and a series of timed images. So those images that you perform for this exam are the AP, the nephrogram, which is the image of just the kidneys, the LPO and RPO, and the bladder, which is the post-void. For this simulation, you'll perform these projections in the sequence that they're presented to you on your guide and today during the demonstration. Because in reality, their sequence is important because images are being taken as the contrast filters first through the kidneys and then through the ureters and then the bladder fills.
So you would say this is time sensitive?
Pardon?
You would say this is time sensitive?
Yes, definitely. I'm raising my table, the AP. Essentially is KUB using a 14 by 17 IR lengthwise. Placing my right marker inferiorly to the outer edge of the IR. Bringing my tube in transverse detent. Aligning my tube and bucky, my central ray, and my IR. Closing the bucky firmly. This is interesting with the 14 by 17, even though the SID is not at 40, you get the automatic collimation. So, and we didn't when we used the 10 by 12, so be aware of that. Bring the tube. We want a 40-inch SID. The closest readout on this equipment that we're going to get is 40.2 or 39.8. I want to make sure that my patient is centered on the table and straight on their table. Ma'am, can you move your shoulder slightly to the right? Just a little more. There we go. I'm going to palpate for the iliac crest. I'm centering at the iliac crest and at the mid-sagittal plane. Taking a deep breath. Blow it all the way out. Hold it out. And breathe exposure. You may breathe. The next image is the nephrogram, the kidneys. So for our nephrogram, we're using the 10 by 12 IR crosswise, centering our IR to our central ray, making sure the IR is centered in the bucky. Close that bucky tray.
It did call me that time, didn't it?
Yeah, but I'm
She's
already
at
at the
40.
40.
Oh.
So I wonder if my SID was decreased, if it would have. Okay, I'm palpating again for the crest. And I'm going to center so that the bottom of the light is at the top of the crest. Now, again, as your book states, the centering technically is midway between the xiphoid process and the iliac crest. And we're using this method of centering so that the xiphoid process doesn't need to be palpated. And I'm centering in midline. Give you breathing instructions, ma'am. By this time, our contrast would be in the kidneys, filling the kidneys. Take a deep breath in, blow it all the way out, hold it out, exposure, you may breathe. So that's the nephrogram. So now we're going to perform the RPO and the LPO. I use a 14 by 17 interceptor lengthwise. For the RPO, I'm using my right marker placed inferiorly to the outer edge. I'm going to get that positioning sponge. Then I want you to scoot toward me just a little bit on the table. All right, and we want to make sure our patient's straight on the table. For the IVU, we're using a more shallow oblique than we had before, only 30 degrees. And we talked Monday about why that is. Our objective is to place the upside kidney parallel to the IR. So a 30-degree angle should do that. Place your left arm across your chest, lift up your left leg. I'm just going to roll you, just want to roll you slightly. I'm going to put this sponge behind you. Go ahead and lie back. That's a pretty shallow oblique. And how are you going to know it's 30 degrees? Well, when you practice, get out this little instrument, find 30 degrees, and judge for yourself. What do you think, Brian?
It's a little too much.
What?
A little too much.
I think so too. I think I've rotated my patient just a smidge too much. So how do I adjust that? Very easily. I'm just going to pull the sponge out from behind you. It allows her to go a little flatter.
So we keep the sponge there the whole time.
Yep. You do keep the sponge there. I think that's good.
Correct.
Yeah. So you wouldn't use this during your simulation, but when you practice, use this. So, see the 30-degree mark on that instrument, the goniometer. Bring that left arm up. Put your right arm down to your side. Your instructions say to center to the vertebral column. And when we get done, I'll explain to you what that means. I'm also palpating for the iliac crest. I'm centering to the level of the iliac crest. Taking a deep breath. Blow it all the way out. Hold it. Exposure. I'm going to remove this sponge from behind you. Go ahead and lie flat. Scoot toward me just a little bit, please. Once again, you want to make sure your patient's straight on the table. Now for the LPO, I'm using my left marker placed inferiorly to the outer edge. Bring up your right arm, put it across your chest. Raise your right leg. I'm going to roll you a little bit to the left. Put the sponge behind you. Okay. Bring that left arm or right arm up. Again, centering at the level of the crest and the vertebral column. Taking a deep breath, blow it all the way out, and hold it, exposure. You may breathe and relax. Take the sponge from behind you, just lie flat. If you took that image, and when you reviewed it, you saw that the right kidney was overlapping the spine somewhat, what would your positioning error be?
You over-rotated?
Rotated too much.
Over-rotated. which is easy to do. So for the bladder, we're using the 10 by 12 lengthwise. I'm putting the right marker on. Arms to your side, palpating for the ASIS, and centering 2 inches below and in midline. And this is your post void. So this means this image is taken after you let your patient up from the table, they've used the restroom, and then they come back. Taking a deep breath, blow it all the way out, hold it up, exposure, and we breathe.